So this is the first lab that we're going to do in Therex 1 this semester. So I'm going to walk through the lab with you and explain the different procedures so that when you come to lab this week, you'll be able to work through the different procedures. First, we're going to start with how to measure a waist to hip ratio. So you're going to measure the circumference of the waist using a tape measure at the spot of the umbilicus, and you're going to record that value. Then you're going to measure the circumference of the hip at the largest point in the hip. So this is going to be slightly different in every individual. Then we're going to calculate our waist to hip ratio. We're going to divide the waist measurement by our hip measurement, and that's going to be our value. Now, if our waist value is larger than our hip value, this is going to be characteristic of a patient that is apple-shaped. And we discussed this in pathology, that someone who has more of an apple shape compared to a pear shape is at increased risk of cardiovascular disease as well as other conditions. So you can see with our table here, we have a high, moderate, and low risk assessment for our males and our females based on our waist to hip ratio. Moving on to our body mass index. So we're going to calculate our BMI using the formula included here. So you're going to measure your partner's weight. Our scale is in pounds. You're going to have to convert that to kilograms. Then we're going to measure height using inches in lab, but we're going to have to convert that to meters. And then we're going to convert our meters, we're going to square our meters, because in our BMI formula, we're going to calculate our weight in kilograms divided by our height in meters squared. And that is going to give us our BMI value. So you can see standard values for BMI are listed here, what's considered underweight, healthy, overweight, and obese. And on the very last page of this lab handout, I have a table that you can look at to see where you fall on the BMI scale. Procedure number 3 that we're going to take is going to be a girth measurement. So there is a video included on Blackboard for this, so I encourage you to watch this video before lab this week. So you're going to have your partner sit with their legs fully supported and knees extended on a treatment table. You're going to measure the girth around your partner's knee, and there's several different locations that I want you to do this, and you're going to measure in centimeters. Okay. So we're going to start measuring at the knee. We're going to measure at the mid-patella, or you can measure at the joint line. In the video, it discusses how to find the midpoint of the patella. You're going to palpate the inferior pole and the superior pole and start at that midpoint. You're going to record that value. You're also going to measure, you can measure 5 or 10 centimeters superior to the midpoint of the patella as well, and record those values. And then you can record girth measurements 10 or 5 centimeters inferior to the midpoint of the patella. Just to keep in mind, however you decide to do your measurements, whether you do them at the joint line or the mid-patella, or if you measure 5 or 10 centimeters superior or inferior, you need to make sure that you document that in your chart. This way, when someone goes to replicate your measures in the clinic, they'll be able to measure exactly at the same point that you did. Something to also keep in mind is that if we're measuring superior to the mid-patella, we're going to be essentially also taking girth measurements of our quadriceps muscle. So superiorly, we often will be measuring the VMO, so that vastus medialis oblique branch of the quads, and this is going to be slightly different on each individual. So practice on several partners in lab this week so that you can kind of identify different locations or positions of where the VMO might be the largest, and make note of that. So it might not always be 5 centimeters or 10 centimeters superior to the mid-patellar line, but just make sure that you document if you're trying to measure at the largest part for that muscle belly. Same thing inferiorly. Typically 10 centimeters inferiorly is more appropriate for the gastroc and soleus muscle girth that you're going to be measuring, but again, it's going to be dependent on each person. For For procedure number 4, we're going to take a figure 8 measure of the ankle. There is a video that I have recorded as well as an additional YouTube video that is posted on Blackboard. The Mansky book, Chapter 2, Box 2.2, has a description of how to do this procedure. There are copies of the Mansky book in the lab on the bookshelf for you to use. So again, you're going to have your patient sitting with their legs extended on a supported surface. I typically have the ankle off the edge of the table, and their ankle should be in a neutral position. You don't necessarily want them completely dorsiflexed or completely plantar flexed. So what you're going to do is you're going to start with the tape measure midway between essentially the medial and lateral malleoli. You're going to pull the tape measure medially towards the arch of the foot. You're going to wrap around by the navicular tuberosity. The tape measure is going to go underneath the bottom of the foot, up around the lateral side, and you're going to then wrap around the malleoli. You should stay inferior to the medial and lateral malleoli and then coming across to where you started. Now you may see different therapists do this slightly different. Some individuals will wrap the tape measure superior to the medial and lateral malleoli. Some will wrap it inferior. So I would keep note of that and see which therapist you're working with and how they take the measure, because you'll get slightly different values when you do it 2 different ways. Okay? Make sure that you record your measurements here. For procedure number 5, we're going to be taking leg length measurements. So we're going to measure 2 different ways. One is called true leg length and one is called apparent leg length differences. So you're going to have your patient in supine on the table. We're going to ask our patient to perform a bridge prior to taking our measurements. This is often referred to as setting the pelvis. It has also been called the Wilson-Barstow maneuver, but more likely you're going to hear it referred to as setting the pelvis. The idea when you have your patient perform this bridge is that you're activating all of the muscles around the pelvis and you're neutralizing any muscle imbalances prior to taking your measure. So our true leg length measurement is going to be from the ASIS on one side to the medial malleolus of the exact same side. Okay? So you're going to do this with your patient and record it in the table below. With our apparent or our functional leg length measurement that we're going to take, we're going to start at the umbilicus and measure down to the medial malleolus. Okay? And we're going to also record that in the table here. So the big difference between our true leg length measurement that we're taking and our functional, or also called apparent leg length difference, with the true leg length difference, this is going to measure actual skeletal differences. So there may be a difference in the actual length of the femur, there may be a difference in the shape of the pelvis on one side versus the other. This is looking for true musculoskeletal differences with our true leg length measurement. With our functional or our apparent leg length difference, we are not actually looking at any physiologic difference. We're looking at anything that may potentially be affecting our measurements, such as someone who has scoliosis of the spine. We have an asymmetry in the pelvis. Sometimes people can have rotations at their pelvis that will create the appearance of there being a leg length difference, but in fact it is more of a functional difference, not a true physiological difference in leg length. Okay? The last thing on our lab sheet is to kind of list some contraindications to doing some of these measures. I want you to think about this and be prepared to discuss this in lab.